Now at 5:30, Ohio State nurses are demanding better security.
Staff the EMS entrance with security and screen patients upon arrival. Install metal detectors at every entrance.
Today's march and protest follows the story we first brought you last week about two guns that were discovered inside OSU Wexner Medical Center and OSU East.
So OSU tonight confirming both guns were brought in by patients who came through the emergency rooms without being screened by security. 10 TV News reporter Kevin Landers broke this story first. He's standing outside now, Ohio State, with what nurses are demanding tonight. Kevin?
Well, good evening. The Ohio Nurses Organization says that gun that was found back in December here at the hospital was loaded. And since then, they've now prompted a change. They want this problem fixed. And with no visible changes, they took their protest to management.
As a profession, nurses are trained to care for people at their worst moment. Today, they marched for their safety.
We should be able to come to work in a safe environment and not fear for our safety, fear that someone's going to burst through the doors with gun and zip ties and threaten to murder us.
The hospital says a loaded gun was found inside OSU Main in December and another found 6 weeks later at OSU East during a patient's CAT scan.
We all feel like sitting ducks, and we demand to have safety when we come to work.
These nurses accuse hospital security of inadequately screening patients entering the emergency room.
Security staff works extremely hard, but they are stretched so incredibly thin.
Nurses say they want more security stationed at the ER and metal detectors at all ER entrances.
Grant and Riverside have metal detectors at all their entrances. So it's not a hard ask that we do the same thing.
Protesters marched their demands to the hospital's CEO office and gave those to his secretary in his absence.
Nearly 89% of frontline RNs that work at this building report that leadership has failed to implement real security measures.
A Wexner Medical Center spokesperson says the hospital has a security presence at the emergency departments 24/7, including police patrols, but said, quote, "We share the concerns of our nursing colleagues about the recent incidents. They are not acceptable. No one should feel unsafe or face the threat of violence when they come to work. Unfortunately, this has become an increasingly serious issue in healthcare facilities, and we have enhanced our security practices over the past several years. We acknowledge the need to do even more to ensure our team members are safe at work, and we are committed to continuing to improve our security practices." Despite assurances, nurses insist that without significant security improvements, they face constant danger at work, and so do the patients they care for.
They're asking us to bring a stethoscope to a gunfight, and that's ridiculous.
Now, last week, a gunman entered a hospital in York, Pennsylvania with zip ties. He ended up killing his hostage and a police officer. Reporting live outside OSU Wexner Medical Center, Kevin Landers, 10 TV News.
Kevin, thank you. Now, Ohio State shared with us the security calls for violence that it has received over the entire hospital system. They say back in 2023, there were 1.98 incidents per 100 admissions. That number decreased slightly in 2024, as you can see, but there were also more hospital admissions last year.